So just what you have to help me, Magali and you, just you have to sing. So welcome back to, may I ask your attention please and to take your seats. So before starting this session, I would like to say hello to those following us through web streaming. You have to know that we have several people following us remotely through web streaming, and they will have a chance to ask questions through the screen that we have in front of us. And I would also like to tell you that some of you realize that we have an info booth just outside this room. Please take advantage. We will have members of my team there throughout the day, both scientists, people dealing with legal matters, financial matters, and really I take this opportunity to thank all my team who really invest a lot of efforts in making this info day as useful as possible. So obviously if you are here, is that because you might be interested to apply to some of our calls for proposal, and you will hear soon about the ongoing call and the call that will be launched later this year. Science will be discussed and the content of this proposal will be discussed later, but it's very important that you also get the necessary information on the rules, on processes, and we will try to explain to you how we try, together with the European Commission, to make these processes as simple as possible. That's a challenge because you know that we still have to face some bureaucracy and some rules, even under Horizon 2020. But the message here is that my team is really there to help you. We are there as enablers, facilitators, help you to navigate under these rules and process and procedures. And also we would like to share with you our experience. Now after 5 years of operation, we have some sense of what makes a consortium, a project successful. So that's why we will have also a presentation on tips for applicants. But we will start with the rules and procedures, and this presentation will be made by Magali Poinot, who is legal manager at IMI and who is indeed involved in this question since the very beginning.
Thank you very much, Michel. So thank you, everybody, for being there today. So that's not necessarily the most exciting part, considering that we will talk about legal and procedural aspect, but these are key elements as well. Oh. Okay, so first, the objective of this presentation is to explain you who may participate to IMI action. The second element is, besides this question of participating rules, who are eligible for funding. The third element, this was already clearly mentioned this morning, it's very important when participating to IMI project to understand the intellectual property framework, because this collaboration is quite different from the H2020, and you have really to consider all these elements forefront. The fourth part, which will be presented by Hugh, will provide you some element on the call process until the signature of the grant agreement, successful tips, and how to get more information a part of today. So this was already clearly stated. IMI is clearly now under the umbrella of the Horizon 2020. So from a legal point of view, you should first refer to the Horizon 2020 rules of participation, which were adopted last December 2013. But of course, considering the peculiarity of IMI, to make sure that we consider the private and the public element, this collaboration, we had to make sure that we introduce in the regulation of IMI some specific element, especially regarding to the funding rules, but also to intellectual property. You had already a flavor in the first session, and now we will enter into more detail about this intellectual property policy. Not only IMI is under this full umbrella of H 2020, all the other public-private partnership, but also the public partnership. So it means clearly that it introduced simplification for all the applicants, because you don't have to look after several regulations to really understand how to apply to X, Y, and Z. Now you have this single reference of the H 2020 rules for participation, and we just spot today the specific element linked to IMI in terms of eligibility for funding and intellectual property. These two elements are reflected in the IMI2 regulation, which was also presented this morning, adopted in May 2014, but also in a Commission delegated regulation adopted in February 2014. You can find all these legal documents on our website, so it's quite easy, and if you have any question, you just ask us and we will let you know how to find the information. So now let's enter in the concrete element. So in terms of participation rule, clearly, you understood that the scope of IMI is wider than before, and we have to make sure that we attract all the stakeholders across Europe and, if needed, outside Europe. We have to make sure that we attract all the appropriate expertise to make sure that our projects are successful, to make sure that the idea gets from the laboratory to the patient, to make sure that we will generate good science to result in good regulation. So we will not only have on board pharmaceutical company, research organization, patient organization, regulators, and small and medium-sized enterprise. We have also to have on board IT company, imaging bodies, health technology assessment bodies, so diagnostic sector. So we have to make sure, and that's the reason why any legal entity that may bring an expertise and may help in reaching the objective of IMI2 may be in a position to participate in IMI action. To summarize, anybody is welcome to build all together and to make the difference contrary to what has been done in the past. But it doesn't mean that all these entities are eligible for funding. I will develop this further in the following slide. But we can also have specific elements mentioned in the call text. That's the reason why, besides this general principle mentioning that anybody is entitled to participate if established in a member state or an associated country, we might have also specific elements to facilitate the participation also of non-European countries. And you have to look at our call text. Of course, to facilitate you in understanding all of our rules, we will not only stick to the document, we will emphasize this information during the info day like today or during any other info day or informative document. Just to leave you in peace for today, for the first call, there is no specific element in our call text, so we just stick to the first bullet point. So, in terms of entity eligible for funding, anybody is welcome, but who will get funding? So, as we had in the past, we will financially support the academic institution, the research organization, the small and medium-sized enterprise, the patient organization, the regulatory authority, the public body. But it was clearly recognized the need to enlarge the scope of financial support. That's the reason why it was agreed with the member state to also provide a financial support to what we call the mid-sized enterprise. Those enterprises having an annual turnover of less than 500 million euros per year. So this will stop refraining them participating in IMI project, bringing their expertise and helping all of us making the difference. All this legal entity to be eligible for funding should be established in a member state or an associated country. Once again, we might have some derogation in our call document, which will not be the case for the first call, so don't be worried about that. But once again, if there is any derogation that will be foreseen with regard to any other entity not established in a member state or an associated country, this will be clearly emphasized by the IMI office. In terms of participation, now we are fully under the umbrella of H 2020. We are fully aligned in terms of full for participation with H 2020, in the sense that when preparing an application, you need to be at least 3 legal entities established in different member states or associated countries. But here I would like really to always remind you, make a difference between a legal requirement and how to reach the critical mass. So you will read the call objective. So you have to make sure that you collect the appropriate expertise. You have the appropriate resources within your consortium. You mobilize the appropriate resources. You have complementarity, synergy. You don't have overlap within your consortium. So even if we have this minimum legal requirement of 3, most of our consortium ongoing projects are composed of more than 3 legal entities. And you always have to distinguish between a legal requirement and what will be needed to successfully achieve your objective. Again, we might have additional conditions in our call document, which will not be the case for the first call of IMI, so be reassured for that, but this might be, again, the case that we enlarge the various conditions for participation, just for you to be fully informed. Now, in terms of funding rules, so you are more than welcome to participate. You are most probably eligible for funding. So, but how much will you get? That's also an important element for your organization. Here again, since we are under the full umbrella of H 2020, we are fully aligned with the funding rules of H 2020. It means that for one project, there will be only one funding rate. IMI, the Innovative Medicine Initiative, will mainly support research and innovation action and coordination and support action. It means that all our projects, all our entities eligible for funding will get 100% of their direct eligible costs. That's a great change compared to the past. You probably remember that we had this distinction between the research activities, the management activities, the dissemination activities, the exploitation activities. Now, all the activities will be funded under the same rate, 100%. And we do not distinguish anymore between different types of organizations. This will clearly simplify the life of the different entities. But it will also reduce the recurring error we found in the past. We might also in the future financially support innovation projects. And for those innovation projects, the funding rate according to H 2020 will be limited to 70%. But as I mentioned before, IMI, the Innovative Medicine Initiative, will mainly support research and innovation action and coordination and support action. So if you have to keep in mind one number at the end of the day, just remember 100% of your direct eligible costs. The simplification has been also introduced in the way you will have to report all these costs incurred during the lifetime of an IMI project. Because clearly now you won't have to fill in specific form just to follow specific IMI or H 2020 rules. We will consider your accounting and management principle with regard to the personal costs, the purchase of equipment, consumable, also your travel costs, but also your subcontracting costs. And in terms of personal, once again, one of the additional positive elements which is introduced in H 2020, we will widely accept the personal call in the sense that we will not only consider the revenue of the staff of an organization, but we may also consider additional payment that are provided to the staff member of an organization up to 8,000 euro per year per person. Sorry. So clearly the objective was to and is to facilitate your participation in any H 2020 and especially in Innovative Medicine Initiative action. The simplification. has been also introduced, not only with regard to the direct cost, your personal costs, the purchase of equipment and consumable and so on, but also with regard to indirect cost, the overheads of your organization. You probably remember in the past that we had within IMI this distinction between a flat rate of 20% or the possibility for you to report your actual indirect costs. Now only one single funding rate will apply, a flat rate of 25%, and it will come to the top of the 100%. If we look at the following slide, just to give you an example how it works. So, in the past, with an investment of 100, with this support of 75% and a flat rate of 20%, at the end, your organization only got 95. Now, when participating to an IMI action, with an investment of 100, your organization will get 125. So you clearly see the difference between previous IMI and the new IMI under the umbrella of H2020. Why all these elements have been introduced? Because we would like to make sure that you do not refrain your participation, not only based on financial element. We have to focus on the science, because at the end, we have to generate good results. And we have to make sure that you will focus during the project implementation only on scientific element. That's the reason why all this simplification has been introduced within H2020 and within the Innovative Medicine Initiative. But IMI, it's not only talking about the participant eligible for funding. You now fully realize, and you already realized it in the past, that IMI is a public-private partnership. We have also an important investment from the private sector, with the participation of the pharmaceutical company, but also of, in the near future, other industry sectors. So these partners are contributing with in-kind or cash contribution. We have to fully recognize this investment because they match the public investment within the Innovative Medicine Initiative. This in-kind contribution might be constituted of making available personnel and equipment, but also by providing cash contribution to the project and then benefiting to the other entity participating in an IMI project. Once again, we will follow exactly the same principle. We will consider this in-kind contribution based on their usual management principle and accounting practices. We will also consider the investment that will be done by the affiliated entity of this pharmaceutical company and other industry when participating in IMI project. Perhaps a short focus on the last element of my slide. It might be needed to reach the objective of IMI, not only to collect, to make sure that we have all the resources across Europe, but we also might need expertise outside Europe to make sure that we reach the objective of the Innovative Medicine Initiative from a scientific point of view. That's the reason why it has been acknowledged from a political point of view, the need to consider this investment from outside Europe within a certain limit, and this will be clearly stated on a case-by-case basis, but we have to consider this external investment in IMI project, and it will clearly benefit to the IMI action. So, and now we've seen you will participate. We really count on your participation. You know that from a financial point of view, now you have favorable conditions. But how does that work from an intellectual property perspective? This was mentioned this morning by Ruxandra Dagerakli, that the key word is the flexibility. Clearly, this flexibility allows collaboration under competitive conditions. This flexibility also allowed in the past successful implementation of IMI project. This flexibility is organized around different key elements. First, this flexibility should serve to support the industrial participation and the industry in Europe and the participation of all the other stakeholders. But this dissemination, this flexibility at the end shall make sure that the information will be accessible by the patient, because clearly this is now the objective, the target of the Innovative Medicine Initiative, the patient. So we have to make sure that this information is disseminated to the scientific community and accessible to the patient. But on the other side, we've seen that, and we already generated a lot of valuable output in the IMI project. We have to make sure that all this innovation that is generated within IMI project will be rewarded. So we have to consider how to compensate intellectual property within IMI project. And this is around these different key elements that this IP policy has been designed, and it has been agreed with the member state that there is a need to derogate to the H2020 rules. How? First, by considering differently what will be brought into the project, but also what will be generated within an IMI action. I'm used to say, from an intellectual property point of view, if at the end of the day you have to keep in your mind only two elements, everything is on this slide. You have to understand this concept of background and the second concept of result. What is background? Background refers to any pre-existing information you own, you will still own during the project implementation, and you will be free to use it, but only the pre-existing information that you will identify as such because you would like to make this pre-existing information available to the IMI consortium. The other participant will have access to this information because you agree that this other partner will have access to this pre-existing information. So, forefront, you identify this pre-existing information in an internal agreement within the consortium. And based on that, they will get some user right on this background. You have to identify this pre-existing information, and you are the one that will decide how to identify this background information. Second element, the result, in the blue box. By result, within IMI, we are not only referring to the result of an IMI project. Result is defined in relation to the project objective. What does that mean concretely? It means that any result generated in direct relation with the project objective will be considered as a result, legally speaking. And when we provide the support to the IMI consortia, what do we say? You have to immediately well define the project objective, because by well defining the project objective, you will be in a position to identify the result that will be generated in an IMI action. So, result is not only linked to the project, but to the objectives of the project. And this is a key element. And I'm used to say, this is a concrete example where you can see you need to make a link between the scientific community and the administrative element of your organization, the lawyers, the financial staff, and the administrative staff, because you have to understand each other, because everything is linked, and you have clearly here a demonstration from an intellectual property perspective. On this background and result, you will have to grant access rights, not only during the project implementation, but also after the end of the project for different purposes. You won't have to only grant access to help the other to achieve the activity, to carry out the activity of an IMI action, but also for any further development. And you might have to negotiate this user right for commercialization purposes. Everything that is outside of these two elements is considered as side ground. And here again, this is clearly a concept that is specific to IMI. Is used to be used in other H2020 projects, but it's not directly resulting from the H2020 rules. Why in IMI we fully recognize, and we really would like to fully recognize, that many other scientific elements are generated with outside IMI action. But for this outside element, we do not impose anything to the IMI consortia. It's up to each consortium to organize the intellectual property regime of the SIG1. But we define a basic legal framework for the use of the background and the use of the result. Practically speaking, in terms of ownership of result, let's take a concrete example. You participate in an IMI action and you generate a biomarker. You will be the owner of this biomarker. If you generate this biomarker together with another partner, as mentioned this morning, we have also set up a basic joint ownership regime. So the one generating a result in an IMI project will be the owner of this IMI result. You can organize transfer of ownership between participants, because just as an example, you have one partner bringing a compound into a project, and there will be many improvements of this compound, and we might understand that the compound owner would like to have a certain control or certain access right or certain ownership right on this improvement. So you might organize internally, and this has been already done in ongoing IMI projects, for the benefit of all the participants, and not only from one specific category of participants. But you have to organize this transfer of ownership, and you have, once again, to organize it forefront. In terms of joint ownership, that's really amazing, because this joint ownership regime, this basic joint ownership regime, was already set up in the previous in the first part of IMI. And now it has been fully endorsed by the H2020 rules. So clearly, the successful implementation of IMI project clearly demonstrated the need of following its principle and translated in other EU-funded programs. In terms of basic regime, so you may decide whether you would like to derogate or not to the joint ownership regime, but at least if you follow it, each of the joint owners might freely use the jointly owned result. But you have systematically to inform the other joint owner and to reward the other joint owner. But you also, and based on the flexibility principle, derogate to that in your internal agreement. This is based on previous experience, and it has been proven very successful. In terms of protection of result, here again, this is a novelty compared to the past, in the sense that before it was not mandatory for the beneficiary eligible for funding to protect or to demonstrate why they wouldn't like to protect an IMI result. Now they have to do so in alignment with the H2020 rules. But we consider within IMI clearly that it's each of the owner which is in the best position to decide how to protect and when to protect. That's the reason why you will have to explain us whether you would like or not to protect your IMI result. Now we have seen you generated result, you know the ownership regime with regard to this result, but you also know, based on my first slide on intellectual property, that you will have to grant user right to the other partner for different purposes. The first one is project implementation, but you will have also to grant access right to your other partner for research use purposes or for commercialization purposes. Let's start with the easiest one, commercialization. This is not mandatory to grant access right for commercialization purposes. This will have to be negotiated on a case-by-case basis between the owner and the other partner. You will agree on the condition under which the access right will be granted. But the second element, research use. Research use refers to any further development of the result, except the commercialization. So it means that it goes beyond the purely academic research. This is a concept you don't know in H2020. And this was specifically designed to answer to the objective of IMI. Let's take a concrete example. My biomarker again. You generated a biomarker, and this biomarker will be used in a clinical trial? Will it be research use or direct exploitation? According to the definition of IMI, the use of a biomarker in a clinical trial will be considered and has to be considered as research use. On the other side, the use of the same biomarker as a diagnostic kit, will it be considered as research use or as commercialization? Here, the use of the biomarker as a diagnostic kit, because the diagnostic kit is a commercial activity, will be considered as direct exploitation. So I sincerely hope you understand this difference between research use on one hand and direct exploitation, because depending on the purposes, the access, the condition under which this access right will be granted will vary. When we look at this condition for research use purposes, you will have to agree upfront on fair and reasonable terms. It doesn't mean that you have already to count the number of euros you will have to pay. It might be, and it has been already agreed in some IMI projects, but it is not necessarily the case. It's not mandatory. You have to define this concept of fair and reasonable terms. This concept of fair and reasonable terms, also, of course, include financial elements, but should not be limited to financial elements. It may also include timing element, other conditions. So it may be also a concept of patent pooling, of exchange of license. So it's really up to you to be creative, innovative in an innovative medicine initiative project. For those access rights that will be negotiated, that will be discussed for commercial exploitation, will have to be negotiated, I already mentioned it, on a case-by-case basis. They are not mandatory, but you will have to discuss with each of the partners. And the last one, the completion of the action, of course, it will have to be on a royalty-free condition. Just coming back to this fair and reasonable versus the royalty-free condition. Fair and reasonable terms, it may be against payment, but you may consider that fair and reasonable terms also include royalty-free condition. Really, decision is in the hand of the IMI consortia, and you will reflect it from a legal point of view in your internal agreement, and during this process, the IMI office will be there and has been already here to support the IMI consortia. Last element on intellectual property before giving the floor to my colleague Hugh Laverty on dissemination. I mentioned it, we have to make sure that the information will be accessible to the scientific community and at the end, really, the most important for IMI, to the patient. So you have to make sure that all the results generated within an IMI project will be disseminated as soon as possible. Oops, that's not the right slide. And we promote the use of open access, the use of public repository. But you have to budget it because it costs. So you have to decide upfront how you will organize this open access approach. In terms of dissemination, we more than encourage you to disseminate the information. But what we ask you is to systematically reflect the public-private partnership and to make sure that you systematically mention the IMI financial support, but also the industrial partner-in-kind contribution in any patent application and in any communication. Dissemination, that's one element, but I just realized that I skipped one slide. So in terms of granting modalities, beside the financial condition, you have to understand that these access rights are only granted if requested on written request. Once again, we have decided to keep the flexibility that was really successful in ongoing action by allowing you to derogate to this principle in your internal agreement. And this was notably the case in most of our previous and ongoing IMI projects. You will have also, and this is a novelty introduced due to H 2020, to agree on time limit. If you participate to H 2020 action, you might probably know that you have to grant access right to your result and your background during 1 year after only the end of the project. In IMI regulation, there is no limit. It's up to you to decide how you would like to organize this time limit. Once again, the objective is to provide you the appropriate flexibility to make sure that at the end you will get the most appropriate agreement considering the objective of your project, because at the end this will be your project. So at the end, I will now leave my colleague Hugh Laverty to explain you in more detail how it works, when you have to apply, how to apply, and giving you some tips and tricks. Thank you very much.
Oh, wobbly. So good morning, everyone. I just want to spend a few minutes quickly going across. For some of you, it will be old ground because you're used to IMI. But for some of you who are coming fresh to IMI, it's important that, well, at the beginning, you get an idea of what you're letting yourself in for. So I'll spend a few minutes talking about how we define the topics, how we go about launching a call, evaluating them, and then also a couple of slides on a consortium agreement and the expectations around the grant agreement. You've already heard this morning from Magda the importance of our scientific research agenda. This is a document that you have received today. I advise you and I ask you, please read it. This document is the framework upon which all of our projects are based. If it's not in our scientific research agenda, we can't support it going forward. Another document that you need to read and understand as well is our annual work plan. This will be published towards the end of each year, and it will give foresight of what we plan to do and what projects we plan to support in the coming year. So if you're interested in applying to IMI, these are two very important documents because these tell you what projects are going to be coming down the road. Under IMI 2, we now have an addition in terms of how projects are defined. For certain areas, we have strategic governing groups, and these are collections of representatives from the companies who are basically trying to make the process by which we come up with new topics more efficient, ensuring there isn't redundancy, seeking advice from external parties when appropriate. And I have to remind you as well that even though we may have a great idea and a great topic, it still has to go through approval by the Research Directors Group at FPA. And we still consult widely with the Member States, with the Scientific Committee of IMI, and also with the EC. So before a project or a call topic even sees the light of day, you can see that an awful lot of work and an awful lot of people have been involved in it. When we actually launch a call topic, it's been defined, it has been agreed, and we will then invite applications from consortia of public entities, of SMEs, academics, regulatory authorities, whoever is needed to undertake the project. We invite you to submit a short proposal, which we independently review, and then we rank these short proposals. And the tough thing about IMI is that we take the first ranked. We only take the first ranked, the top one. And we invite that applicant consortium to merge with the original industrial consortium that came up with the topic at the second stage. And then we ask that public-private consortium to work together on a full proposal. We then have another round of independent review of the full proposal, and if everything goes to plan, we then invite the successful consortium to work on a consortium agreement, and based upon a successful consortium agreement, we will then, the IMI Programme Office, we will sign a grant agreement and the project can start. In line with what you've already heard, a lot of our activities are now aligned with Horizon 2020. So for those of you who know Horizon 2020 and have already applied, this slide should not come as a surprise. We have three evaluation criteria for our evaluations: excellence, impact, and quality and efficiency of the action. For two-stage evaluations, only excellence and impact will be considered at stage 1. So quality and efficiency of the action will be considered at stage 2. If there are any thresholds or any weightings that you might be used to, these will be clearly described in the call documents, but be warned they may not apply, so read the call documents carefully. And we'll have a panel with a minimum of 3 independent experts undertaking the evaluation. A very important point to consider for those of you who want to apply, each proposal will be evaluated as it is, not as what it could be. So there's no room for guesswork. If you're going to do something, you have to describe it accurately and concisely in your proposal. The reviewers will not be able to guess what you were going or what you were not going to do. So please remember that. In terms of the evaluation criteria, specifically for excellence, I'll just read through these for you because it's very important to remember and understand how your proposal will be evaluated. So in terms of excellence, the following aspects will be taken into account to the extent that the proposed work corresponds to the topic description in the IMI 2 annual work plan, hence the need to read the work plan before you apply. So clarity and pertinence of the objectives, credibility of the proposed approach, soundness of the concept, including transdisciplinary considerations where relevant, extent that proposed work is ambitious, has innovation potential, and is beyond the state of the art. And finally here, mobilization of the necessary expertise to achieve the objectives of the topic and to ensure engagement of all relevant key stakeholders. Now, for those of you who are used to Horizon 2020 already, the text in black will be familiar to you. We have 1 or 2 aspects within our evaluation criteria that are specific to the peculiarities of us being a public-private partnership, and we've highlighted those in green. Likewise, with impact, the following aspects will be taken into account to the extent to which the outputs of the project should contribute at the European and/or international level, the expected impacts of the proposed approach listed in the IMI 2 annual work plan under the relevant topic, enhancing innovation capacity and integration of new knowledge, strengthening the competitiveness and industrial leadership and/or addressing specific societal challenges, improving European citizens' health and well-being and contribute to the IMI 2 objectives, any other environmental and socially important impacts, effectiveness of the proposed measures to exploit and disseminate the project results, including IPR, to communicate the project and to manage the research data where relevant. And again, 2 aspects here specific to IMI. And finally, the third evaluation criteria, which is quality and efficiency of the implementation. So for most of our calls, it's a 2-stage process, so this would be considered at the 2nd stage. So coherence and effectiveness of the project work plan, including appropriateness of the allocation of tasks and resources, complementarity of the participants within the consortium, clearly defined contribution to the project plan of the industrial partners, appropriateness of the management structures and procedures, including risk and innovation management, and very importantly for IMI, sustainability. What is going to happen to the results and the data beyond the term of the project? And we ask our applicants, and particularly successful applicants, to plan for that eventuality. In line again with Horizon 2020, we will have 8 months from submission of a complete proposal to the grant agreement. So this is broadly in line what we have been able to achieve with our previous calls, and as well to speed up the process, we have legal entities validated in parallel. So that's just a very broad overview of the call definition and the evaluation process. If you are successful and you get all the way through, before we will sign a grant agreement with you, we ask the successful applicants to come up with a consortium agreement. So this is a contractual arrangement between all participants to set out their rights and obligations, especially in terms of governance, liability, and IPR. It has to comply with our model grant agreement under IMI 2, and as I've said, we will not sign the grant agreement until all of the participants, big, small, public, private, have agreed their consortium agreement. And of course, we recognise that IMI projects have very different characters, tackling very different topics and challenges, and so it can be adapted to the specific needs of each IMI project. Again, in line with Horizon 2020, we have a simplified model grant agreement. So before you had to look across many different documents to try and find the relevant clause and the relevant conditions or specific provisions. Now they're all pulled together into one place, into one document, so you don't have to root around. I can't guarantee that the legal language has been simplified enough, but at least everything now is in one place. So, and now I want to very quickly just mention a couple of mistakes that we see on a routine basis. And I apologise now that if you think this is very simplistic, how can this be possible? But we still see this, even though I've been giving this talk for 4 years, we still see these mistakes. Maybe I'm not a very good presenter and my message isn't getting across, but this still happens. Even though it clearly states in all our documents and on our website when the submission deadline is, it's still missed. Only a couple of weeks ago, I got a phone call at 5 minutes before the deadline saying, I can't finalise, what do I do? And what was wrong was that they hadn't filled in all of the fields. So, unfortunately, if you miss the deadline, you miss the deadline. Sometimes the proposal is out of scope. We are not like other parts of Horizon 2020 where we have a broad topic and you can put in a wish list of what you would like to do. Our call topics are very precise, they give clear instruction of what is required, and you must submit your proposal in answer to the call text. If you have any doubts, contact us, ask us, and this will be a recurring theme in the next part of my talk. We have a tool, the Sophia tool, that you need to upload your proposals on. We cannot accept a hard copy that comes in the post. We cannot accept an electronic version that is emailed to us. We can't even accept slides, although people have tried. I have received a slide deck once in the past as a submission. You need to register on the Sophia tool and you need to use it to upload your proposal. And as Magali has already described, you need a minimum of 3 legal entities. And again, I would really emphasize the point. That's the legal requirement. When you read the call text, you will see that you will need more than 3 legal entities to undertake an IMI project. You will need a multi-stakeholder, multidisciplinary team. So you need to fashion your consortium around the objectives. We have received proposals in the past that are broadly good. The only problem is that if you have 6 or 7 key objectives, the proposal only tackles 3 or 4 of them. In that case, you won't be successful. We also receive very good proposals, but we can see that there is an imbalance in the consortium. And this comes back to the point, please spend some time trying to get the right skills needed into your consortium, into the different partners. We either have consortiums that simply don't have the activities, or they do have the activities, but we actually have 50% of the partners all working in one area. In both those cases, when you're up against a well-balanced consortium, that really will work against you. So pay attention to your partners and to the way you construct your consortium. This was true for, the next point was true for IMI previously. It's now even more important when you consider one of the evaluation criteria is impact. Scientific excellence is a given. It's a requirement for all of you to apply to IMI. We receive scientifically excellent proposals, but they miss that part which shows how you're going to change, how the results are going to change either pharmaceutical processes, the way clinical trials are done, or the regulatory environment. This is a key element now of IMI 2. Please demonstrate and show that you're not just going to do good science, but you're actually going to change the way in which we develop new pharmaceuticals. And I know we have a box. Does your proposal contain ethical issues? Some people say no, even though the project has use of animals, patient data, and they still tick no. This gives a really bad impression to the reviewers. So when you think about completing your proposal, just make sure every box is ticked in the right way. So the tips are very, very simple. Again, I apologize for the simplicity of the message, but it is very simple. Please read all of the call relevant material that is provided on the IMI website. All of our rules are explained, the call text is explained, the evaluation documents are there. Everything you need is present, so please read it and understand it. Respect the rules, because this is what your proposal will be judged against. And again, if in doubt, if you don't understand something, if something is not clear, if you have a general query, contact us at the programme office. It's our job. We are there to try and make you as successful as you can possibly be. We can't guarantee success, we can't say you're going to win, but at least we can make sure that your proposal is as good as it possibly can be. We also advise start working early. We provide a lot of pre-reading material, so already today you will hear about some topics that will be going forward for Call 2. Call 2 won't be launched for 2 or 3 months, but already today there is information on future topics. It's highly likely that those topics will be launched, so therefore you already know by attending this meeting future topics within IMI. If you read the annual work plan, you will already know the future topics that will be coming up under IMI. You can start working now on making the contacts, on building the network, on building the partnership you need to apply in the future. And please complete all the fields in the electronic tool and finalise your submission. Because if you don't finalise the submission, even though the tool tells you that you have uploaded your document, we can't see it. So it's a little button. If it's the most important button you press, it's finalise. If you want to submit a proposal, you need to register on our Sophia tool, and it's showing here, the web address. You have to request access. You can't just access it straight away, and then you will be given access once you've requested that. For IMI calls 1 and 2, we will still be using the Sophia tool. However, we are going to transition towards the participant portal that you heard about this morning from Roxandra. But it will be a stepped approach, and we will provide more information as we move to that tool for future submissions. But remember, for those of you applying to Call 1, you still need to register on Sophia and use the Sophia tool. We also recognise that one of the most difficult, if not the most difficult part of being successful in an IMI application is your consortium. You need to find the right partners and bring them together. In an attempt to try and help the many people that contact us who say we need to find partners, we developed a partner search tool. So you can go on here, you can load your details of your organisation, put in keywords, you can search, and you can try to find other partners. There are many other partner search tools available. I would recommend Fit for Health, the German representation, they also have a really useful tool as well. So there are many tools out there that can help you find potential partners. But actually, the most important event you're at is today. When you go to the workshops this afternoon, you will be sitting in the room with people who are interested in that topic. So don't be shy, turn around, say hello, introduce yourself, find out what they're doing, who they are, and you may have several partners there already waiting to work with you and collaborate with you on an application. So, more information. We have lots of information. We put everything on our website. There are lots and lots of documents. There is no excuse for not being informed. Okay, maybe we put out too much information, but it is all available. You can find it. So on our website at the minute, you can find the Horizon 2020 rules for participation, IMI2 delegated regulation, IMI2 call documents, the IMI2 model grant agreement, and there's still some discussion ongoing, but soon we hope to be able to publish the IMI2 annotated grant agreement as well. But you can find all the relevant information associated with IMI and there already. One way of getting more information is just simply to stay in touch. Our website is updated on a regular basis with what's happening in our projects, with project achievements. There's information on all the ongoing projects. There's information on all the calls, on the processes. So please check our website on a regular basis. Also, sign up to the newsletter. The main events, the main achievements of our projects are published on a regular basis. It'll be sent to you. You don't even have to go trying to find anything on the internet. It'll pop up in your email box. If you're into social media, you can follow us on Twitter and LinkedIn. And as I keep saying, the most important thing is if you have a question, if you have a doubt, if you don't understand something, contact us. We have legal officers, financial officers, we have scientific officers who are there to help you and to explain everything so that you can be as successful as you possibly can be. You can also get information on IMI by going through your local IMI contact point, and the email address to find their details is here as well. And you can actually get information on IMI as well from your Health National contact point. Okay, so that's the presentations finished. I think we're going to move now to questions and answers, so I'll hand over to Michel.
Thank you very much. So indeed, we have no time for questions. Perhaps shall we start with questions that we received through the web? So there is a first question. There is considerable amount of collaboration between EU Institute and non-European Institute. Does IMI have any further plan to include those in their agenda? I think that you already got part of the answer. But let me tell you that indeed the challenges that we address in IMI are global challenges. They are not restricted to the European Union. We know this since the very beginning, and that's why we have signed a different memorandum of understanding with organizations such as the Critical Path Institute and the Juvenile Diabetes Research Foundation. So it's clear that in the future, for example, in the project for Alzheimer, there will be further contacts with organizations worldwide, not only in the US. You know probably that there is no World Dementia Council, and IMI is very active there. So you can anticipate, indeed, there will be more and more conversations and collaborations with institutions outside Europe. At the end of the day, it's essential to fulfill our mission, and again, all the information will be on our website. Practically speaking, for those who are interested in the collaboration with the US, there will be soon our annual meeting, IMI, with the Critical Path in Washington, and you will find the information on our website, and you will see that there we really address all these questions related to collaboration between scientists, but also, which is so important for us, collaboration with regulatory agencies, especially the European Medicine Agency, EMA, and the FDA. And actually, in the context, immediately after this meeting with CPAS, we have our meeting with FDA and EMA. So indeed, IMI is fully aware that his mission is global. So the second question is, IMI has put together scientists coming from different environments. Who is a good scientist that successfully collaborate with external partners? We could spend some time to discuss this, but let me tell you that a good scientist on board of IMI project is a scientist who obviously is recognized as excellent in science by his track records, but also a scientist which is interested in collaborating to translate what he's doing in the lab or in the clinics in the standard of care for patients at the end of the day. And So it's someone, even if doing very complex research, addressing complex challenges scientifically, the good scientist in IMI is the one which also remain interested by questions related to knowledge management, questions related to regulatory guidelines, and most importantly, questions related to how patients can really be put concretely at the center of our research program. This would be my answer. So now we have time for questions from the audience. We will still monitor the screen. Yes, please.
You have no chance to see. You have no chance to see all the partners. Do you have a chance to improve the partner search page? It's really not user friendly, and yeah, sometimes you really get crazy about it and you leave it.
So we recognize the issues we have with the partner search tool, so there are 2 points I would make. Yes, we're trying to improve it. That's why we are talking with Fit for Health. We're trying to direct people towards other networking tools. The other bit of thing I would say is that quite often what we find is that prospective partners go to the tool quite late in the process. And so what we try to do now is put a lot more emphasis on meetings like this, on more general networking through things like Fit for Health or the German platform as well. So yes, we recognize the limitations, we're trying to improve it, but at the end of the day, I think if applicants are coming to this very late in the day, then they're at a massive disadvantage, because one of the challenges we face, and been very honest about it, is that a lot of the lead applicants who are forming consortia, they don't necessarily sign up to the partner search tool. And that's an obvious disadvantage as well. We have examples where people have found successfully partners, but we recognize the issues with it, and we are trying to improve it, but I think we have to recognize that there's only so much that we can do with that tool. I think the other complication that we have as well is that it's not the role of the program office to get involved in forming consortia. We try to bring people together, but it's something we have to try to stay aloof from to ensure that we don't experience any conflicts of interest when we come to evaluation. So I understand the frustrations, we hear it many times, and we are trying to improve it.
Yeah, please wait for the microphone.
Hi.
Yeah, please.
My name is Kees van Bokhoven. I'm the director of a bioinformatics software company based in Utrecht and Boston called The Hive. I would have a question for Magali Poinot. You mentioned that for publications, IMI would require open access. How about software development? It seems to me that if software development is funded by IMI, since IT is not a primary purpose, that the software should be available to the community in general by making it open source.
Yes, indeed. I like your question because it gives me the opportunity to explain the difference between open access and open source. I think you will understand it, but it's not necessarily the case of all. So yes, clearly your objective is to make sure that all the publications are accessible, or freely accessible at least, to the scientific community. This question of open access raises also some question from an intellectual property point of view, because it might be certain countries that software may be patented or are patentable. That's the reason why this concept of open source is left to the decision of each consortium. But we fully support support, of course, the open sources approach by making sure that the software might be used by anybody in the scientific community, might be further developed within the scientific community for the benefit of them, and also to make sure that this will be used at the end. But we wouldn't like to intervene so much in the sense that it also impacts on our protection policy and the one that we request the participant to protect their result, and software being patentable in certain countries or under certain conditions. That's the reason why we leave this to the consortium responsibility and decision. But we fully support this position, of course.
Yes. Yes, please.
No? I'm not sure this is on. Yes. I'm Isle van der Planken from KU Leuven. You indicated that one proposal will go to the second stage, and you mentioned that there will be at least 3 evaluators in the first round. But could you perhaps elaborate a bit on how they will pick the winner, actually, if only one proposal goes to the second round? And I can imagine there will be some competition there. Thank you.
So at the first stage, we will receive anything from 5 to 20 to 30 applications, and the review panel will use the evaluation criteria that we've described to score and rank those applications. Then we take one, the top ranked, and we invite that top ranked consortium to merge with the original industrial consortium. And then we ask them to write a full proposal that then undergoes another round of review. And what we ask them to do is to check that there haven't been major changes in the scientific approach that has been defined, that there aren't major changes in the consortium, so that basically the application at stage 1 is still the same at stage 2, but what we ask at stage 2 is a lot more detail on governance, on how risk will be managed, on work plans, on milestones and deliverables, and that's why actually it's the quality of the proposal that is then considered more at stage 2. So the focus, first stage, very much on the science, very much on the response to the call. At the second stage, it's very much on the integration of the 2 consortia, ensuring that the science is still sound, that nothing much has changed, but actually that the management plans are much more detailed and are sound as well. So there's a difference between stage 1 and stage 2.
Okay.
So, oh, sorry.
Let me comment about this. The process of evaluation is really central to IMI success. So we pay a lot of attention in selecting the best experts worldwide. Actually, you can see the names of the experts that were used on previous years on the website. The names are made public generally, and you will see that we have their prominent figures. So that's point number 1. Second, we try to have on board the necessary expertise. It's not easy. These are, as you understood, by nature, multidisciplinary projects, so we need to bring on board different expertise. We need different perspectives, not only from academia, not only from large industry, but also from small biotech. So I can tell you that my team spend a lot of time in, making the right selection, which means that although in IMI 2 a minimum of 3 is indicated, I anticipate that for most topics we will have more experts on board, something around 5, but legally speaking there will be at least 3, most likely very often more than that. I insist on this point because we are fully aware that in the scientific community at large, some people in a way are disincentivized to apply because they think that there is already a consortium which has been pre-identified. I would like to say very strongly that we do everything we can to make sure that the evaluation and selection process is as open and fair as possible. Obviously, we cannot control what's ongoing in the scientific community, but I really encourage all those who are good scientists interested by IMI, having interesting things to propose, ready also to reflect out of the box, out of their usual comfort zone. So these people should indeed try to be involved through their contacts, identify the right partners. That's extremely important, and for me, that's a key for the future. We have really to convince everyone with good ideas to come on board, and to do this, for me, the evaluation process and the right selection of experts is indeed critical.
Michel, can I? Sorry, just to follow up, it's a very simple explanation to your original question, which was that when we evaluate the proposals under the different criteria, a score is given. So under excellence, under impact, a score will be given, and then we will simply add the scores together, and the proposal that has the highest score is ranked first. Sorry, it's very simple, it's very straightforward.
Yeah, please.
Okay. Hi, my name is Sophia Kuhn. I'm a science communicator from Union Science Communication. I would like to ask about the importance of communication and dissemination in IMI too. I know that in Horizon 2020 this has been emphasized quite a lot, the public outreach of scientific results. And I would like to ask about your recommendations for including a dedicated science communication partner in the IMI 2 project, and also how this will then be assessed during the assessment process, whether that's a benefit, perhaps, during the project assessment. Thank you.
So I will probably give a first answer and follow up by my colleague from a scientific point of view. In each of the applications, we are requesting the applicant to provide with a communication and dissemination plan. So whether you have to appoint a person dedicated to that, it's really depending on the content of your communication and disseminate plan that will be at the end to be discussed with industrial partners. So because you have to make sure that this expertise doesn't exist within another organization, and especially from the industrial part. But you have to provide this information because it's important to make sure that the information is communicated and disseminated. So from a practical point of view, you might perhaps give your insight.
There's not very much more to say to that, but communication is a requirement in terms of the results, in terms of dissemination. We spend a lot of time at the programme office trying to communicate on the success of IMI and the projects and holding events like this. And we spend a lot of time trying to get information out of the projects as well. So anything that helps the communication of results out into the wider community, raises the profile of projects, raises the profile of successes under IMI, is something we support. As Magali says, we do ask for a communication plan, and we have a communication team within the programme office that works very closely with the communication teams on our projects. Whether you need to have a dedicated person or a dedicated team working on communication, it's really dependent on the project, but I would say that it's a very good thing to have, and with the size of the projects that we support, it would be something that I'm not on the review panel, but it may be an advantage to have that as well, in terms of at least in terms that someone is dealing with communication and dissemination of the results. So I think it would be viewed positively.
Yeah, let me add something to this. First, I think it's very much dependent on the nature of the topic, so I would not make too strong recommendations here. I think it has to be considered according to the topic and the consortium. But the important point, which is true not only for communication, but for every aspect of your project, you have to remember that, after you are selected, if you are successful, you will have to develop a full project proposal with your partners in industry. So try to anticipate this when you write your expression of interest. You will be supported not only for your own ideas, to implement your own ideas, but at the end of the day to implement a joint project conducted with partners that will join after you have been selected. That's true for different aspects of your project, including communication. Yeah, 2 questions.
Thank you. You said that in the first stage, 2 criteria of validation will be taken in consideration, the scientific excellence and the impact. Well, the science impact is quite broad to me. I mean, there's an impact on social basis, on applicability, on economical basis, on whatever. So, is there any priority of the impact, or how it's, and in case there are 2 proposals, let's say, which are, one is scientifically talking excellent, another one has better view to the impact, is there any freedom to the IMI to merge 2 or maybe more than 2 proposals in case they realize that this is something feasible?
So again, it comes down to the call text. All of our projects, it's a general criteria that you need to think about the impact. And the call text and the topic will actually specify the desired impact, whether that be on manufacturing, whether that be on clinical trials, whether that be on regulation. So actually it will be very clear the desired impact, and then it will be up to the applicants to show how through their working together in scientific excellence they will be able to deliver that, that impact. In terms of merging, it's not something we like to do because, as you can imagine, it's a complicated process to merge one consortium with an industry consortium. But it has happened in the past, but it's an exception. It's a very rare exception, and under very specific circumstances. In terms of what you have described, I wouldn't foresee that that would be a reason for merging 2 consortia, because the requirements are so clearly laid out within the call text.
And a very small clarifying question. Magali said in her presentation that there are SMEs, eligible entities SMEs, and new SMEs. What do you mean by new SMEs? I mean, young SMEs?
Did I really mention new SME?
Yes.
No, I mentioned.
The larger?
I mentioned what is new as part of our rules is that now we also financially support a mid-size enterprise, which are larger SMEs.
Yes.
You mentioned that you receive proposals with the box no ethical issues ticked, whereas there are ethical issues. Now for Horizon 2020, at least for some proposals, you have to go through a detailed question-answer list where you have to answer questions like, are you using experimental animals? If yes, then you go to the next question, are any of these animals primates? If yes, and so on. Are you using patients? If yes, or some of them, and so on. For each of the boxes that you have ticked, you then have to submit in the ethical discussion a point-by-point discussion, otherwise you cannot even submit the proposal. Why not use that?
But we do use that.
Okay, but then it's impossible to receive one with the box no ethical issues ticked.
I can assure you we have received proposals in the past where the table has been left blank and we have been told there are no ethical issues even though there is the use of animals or there is the use of patient data. That has happened. So I can't explain why it's happened, I can just tell you it has happened.
Yes, please.
People Airs, Brussels Free University. Dr. Goldman, do I understand it correctly that at the first phase, it is not necessary to have already agreements with major partners in the industry consortium to be selected? Because the rumor is around that this is required. So if that is not the case, what happens if a proposal is selected on basis of scientific excellence, but if one of the major industrial partners in the consortium is not really interested in it? Mm-hmm. Or will they play a role in the decision making?
Thank you very much for this question. So the answer is, indeed, you don't have to have any type of agreement with any large pharmaceutical companies to be successful. And actually, we have numbers of that. We have a number of consortia which were successful, with, and we know that they had not any contact, any discussion with companies before. And actually, our experience, and that's why the evaluation panels are so important, our experience is that, you know, companies, at the end of the day, they might recognize the value of a consortium they didn't anticipate. And after a few years of operation, very often, they come to us and say, well, so that's why we didn't think about this consortium, but really they brought the innovative ideas that we need. I know these rumors, that's why I made this comment. We cannot do much against this, we can just tell you how we operate. Yes?
Sort of a follow-up on that. Can one entity be part of two bids?
Yes. Can one entity be part of two bids? Yes. Yes. It's very simple. You often see it when there is a requirement for like a very specific clinical cohort, or like where there's samples that are very precious. And then we sometimes see that the same entity applies on several proposals. What I would suggest and advise is just that if you're considering being part of two bids, just tell your partners on both bids so that they're not surprised. There's somebody here.
Stefan Pollmann, University of Magdeburg in Germany. As someone new to IMI, it appears to me that it is almost more important to be in the right consortium than having something to offer as an individual or individual group. So is there no way to consider contributions that have been evaluated as excellent, but being part of a consortium that did not win the first place?
The basis of everything is scientific excellence. So even if you're a fantastic entity or wonderful university, but you are on an application that is scientifically not very good, it doesn't matter. What we're talking about are examples where you have several scientifically excellent proposals received. And then what the reviewers will do will look at those proposals and make an assessment on which consortium can really deliver, not only in terms of science, but also on impact. So what you often see is that it is the blend of the consortium that can sometimes become a distinguishing feature when the science is very, very close. But the priority is get the science right, address the call correctly, and then make sure that you've got the right partners in the consortium. So, but the review does not depend on a name or two names, or it's the ability of the full consortium to deliver all of the objectives. So it's not quite that specific. I'm not sure if I explained that very well.
No, that's very good. But one important point against in IMI, if you have, a project which is, let's say, ready because it was rejected for whatever reason elsewhere, you still have to work quite a bit to have it successful in IMI, because IMI is unique in this partnership with industry. So just to do a copy-paste, it's unlikely that indeed you will at the end meet the expectation and requirement of your partners. And we pay a lot of attention to that in the evaluation. So I think that it could be a good basis, but then just think how you could contribute to a project when you have new partners joining.
That's right, but in the same way as the first place consortium goes into negotiations with the industry partners, why not allow at this stage also merging of very good parts from different consortia that might even strengthen the winning consortium?
I think it's the fundamental principle of that the consortium as a whole is evaluated, not individual partners. So there may be strong parts of a consortium, but you then, if you think about it, you then have to go to a consortium, you take out a part you like, you discard the partners you don't like, then you bung them into a consortium that don't want to have the good part because they think they're good. It's just too difficult in terms of bringing everything together, and it wouldn't work. It would cause more problems at the end of the day, I think anyway. So.
Hi.
Yeah. Where?
Working?
Yes, please.
Are there any statistics available across the first 5 years of IMI for success rates at, I guess, the second stage when the first ranked consortium has been invited to work with the FPR consortium?
Well, I think out of more than 50 projects now, I think we only know of one or three situations in the beginning where this was happening. But, and I think that some of them were at the very beginning, yes. Right? So, for the last 3 years, I think that probably have been one case, but I think that basically the success rate is really close to 100%. However, it's very important that still this second stage is considered very seriously, because what is happening, and this is quite often, we have a final review panel. So it might be that at the second stage the panel indeed make recommendation, but pending on changes in the full project proposal, further clarification. So this is still a very serious step, and we pay a lot of attention to have this full project proposal carefully reviewed, because at the end of the day, is the use of taxpayer money. Also, what you have to know is that we pay a lot of attention to interim reviews. Usually these interim reviews took place after 2 years to make sure that indeed the consortia are delivering what they are supposed to deliver.
Yes, good morning. Yes, my name is Ken from Commission Services. I just wanted to make one comment on this question of potential merging of individual partners. While that is, of course, a good idea in principle, indeed, as colleagues already explained on the panel, this would be in practice probably quite difficult. Furthermore, it would not be consistent with the overall approach in Horizon 2020, where proposals are evaluated as they are submitted, and it really would open the room for a lot of things that are difficult to control and would be counter to the equality of treatment between the different applications as they are submitted. And it would also probably take a lot of time, which we want to avoid in our process, where we want to move forward rather quickly with the proposals.
Okay, if there are no more questions, perhaps the last question or comment.
Yes, Michel. Matthias Gottwald from Bayer Pharma. Just a quick remark from the industry side, from the discussions we currently have on the overall philosophy. As many of you know, in IMI 1, the projects were normally set up or governed by a coordinator coming from the industry side, the one who has written also the topic proposal which has been published, and the managing entity on the public side. And the wording is changing under IMI 2, under Horizon 2020, but we expect that also in most IMI 2 projects, it will be the case that there will be the overall consortium project leader, or how we call them, from the FPR company leading the industry consortium, and an administrative coordinator on the public side. So also I would like to ask you to be prepared to have this project administrative work built into your work plan.
So perhaps there was a very last, but that will be the last question. So yeah.
Good morning. My name is Andrea Alvarez from Universidad del Norte in Colombia, South America. My question is about the participant eligibility, of course, and I would like to know how can be addressed or how can be helpful our participation in IMI projects. Taking into account that we are eligible to participate, but we are not eligible to receive funding, for example.
Yeah, so as I explained in the first slide, as a principle, non-European based entities are not eligible for funding, but there might be in our call text a specific element mentioning the eligibility of a certain organization. This was not foreseen for the first call, but it doesn't mean that this won't be the case in the very near future. And secondly, during the evaluation, depending on the composition of the consortium, the added value of the expertise of such participants, it might be agreed on a case-by-case basis that this non-European-based organization will receive a financial support. This won't be a general principle, but this is still an option, but it means that the added value will have to be clearly demonstrated considering the objective of the call. But once again, it might be, and it will be probably the case in the near future for other topics, that we allow the financial support of other organizations that those established in a member state or an associated country. So you have really to keep your eyes open.
So thank you very much. I think that time is over. So I would like to thank Magali and Hugh and all of you again for your active participation. So please enjoy the lunch and take advantage of the lunch as a partner search tool, and also take advantage of our team who will be around to answer any further question you may have. Thank you.